physical status. So there's no, whether poor or rich, there's no discrimination according to the physical features. I think I've already spoken about the waiver. For the disinfection, if you go to isolation centers, particularly if you go to the dome, which is being prepared now for admission, it has been formally accepted administratively. They have a medical superintendent, and the team is being built up. You will see that they have protocol there for healthcare workers, how they are hosed down, and how they change, and where they don and where they doff the clothes. When they are leaving, they doff, and where they are coming, where they wash their hands. So these protocols are there. They may not be necessarily mechanized, as you may have been seeing in some clips, but there are systems that are there to make sure that you come in and you prepare yourself, you are safely attired to enter, and then when you come out, you are safely prepared to drop your dress and also your gowns, and then also prepare yourself to go home and be on your own. Thank you. I think those are the questions that we have.
So thank you very much. Just a few questions. One on the gene experts. We have about 400 gene expert machines across the country. Not all of them are appropriate for COVID. We need those that have a biosafety cabinets where they are located. And we also need those that are functional. Some of them have been around for quite a while. So we had to prioritize, so we continue to do this. 17 of them are immediately ready for deployment in the first phase. That first phase will start next week. I'm happy to announce that our first set of Gene Expert cartridges will arrive in Nigeria on the 25th of May. It's the first time I'm able to actually say a date. So this is thanks to all the people that have been working very hard behind the scenes to make this happen. So once the flow starts, we'll continue from there and we'll continue to expand. So we'll start with 17 sites, starting with, a lot of criteria in deciding who gets first. Firstly, in states where they don't have any lab at all, and secondly, in states where they have a high number of cases. So we'll go to states that have a high number of cases and no existing lab at the moment, and start from there, and then we'll scale. So from next week, that aspect of our testing strategy will start expanding, and we'll see continuous increase from there. On our discharge criteria, we changed it from 2 tests 24 hours apart or 48 hours apart to a single negative test. The reason is that most of our cases that tested negative also tested negative for the second time. So we found out that, of course there will be some exceptions, but in most cases, once they tested the negative the first time, the second test was also negative. And given the pressure we have on bed spaces, especially in Lagos, Kano, and FCT, we made a pragmatic decision to move to 1 negative test as sufficient to discharge people. There will always be exceptions where this is not appropriate, and of course, this is dependent on your being clinically cleared of symptoms. So if you're still symptomatic, then of course, this doesn't apply to you. In terms of adding the deaths in Kano to our national database at the moment is based on virologically confirmed cases, so cases confirmed on PCR. Once the results of the Kano study are completely verified, we will note them, but we will not include them in our database because of the difference in methods in estimating the number of people infected and have died in that particular context. In terms of the elderly and how to look after them, we can't be completely prescriptive about this because unlike in many parts of Western Europe and the West, where many people live in older people's homes and you can regulate that fairly efficiently, our elderly live very often in our communities, in the villages, sometimes at home with us. So the key thing is to protect them, to limit access of people to them as much as possible. That limiting access might mean, listen, if they're in the village and you're very attached to your parents and you have an urge to visit them fairly frequently, please send them money or send them whatever they need to survive and avoid visiting them for some time. this might sound counterintuitive, but by visiting them less, you're doing more for them at this point in time than anything else you might be able to do. So please send them food, whatever presents you want to, but it's better to leave them where they are right now. And even if they're living with you, to limit contact to the outside world. I know that's very difficult because the elderly are often the most frail and require a lot of support. So we all have to find a way of managing. But this is really not simple. And one of those things government cannot be very prescriptive about because we all have to manage the circumstances ourselves a little bit. There was a question about houses. I've said this very often. The most important thing in our homes when there's someone infected is wiping surfaces with bleach and water. You know, we have a very simple solution. 1 component bleach, 199 components of water, or you mix half a glass in 1 gallon of water and get a very effective medium to clean surfaces. So once the surfaces are clean, actually, you have done 99% of the work. So, you know, this is really what it takes. It's not some magic. I know we fumigate and all of that, which is always good for many other reasons. But in this particular case, to make sure that we avoid transmission of the virus, there are two main modes of transmission. One is from droplets. That's why we're all wearing masks. And secondly is from surfaces that we touch and leave the virus there. So if you use bleach and water, you kill most of the viruses on the surfaces. And finally, I think there was the question on contact tracing and how we can make sure that people are doing what we say they should do while they're isolating. I come back to what I always say. You have to take responsibility. None of us at NCDC or the PTF or the police is going to go put cameras in your homes to make sure that you're actually doing what you should be doing yourself to save your own life and to save the lives of your family members. So really, this is about people taking personal responsibility and not to impress us or to make anybody happy, but to save your own life, save the lives of your family, your loved ones, the vulnerable people in your own community, and help us control this outbreak. So really, that's the essence. Contact tracing in this sense is not really tracing in order to enforce. It's tracing so that you can be offered the information that you need to do what you need to do to save lives of yourselves and others. So thank you very much.
Thank you. I think I have 3 questions. So the first one has to do with whether or not the PTF is working with certain state governments and why do we have a disconnect in terms of the advice we give. Well, first of all, I would like to say that the containment measures that we advise are always take into cognizance the social, the economic, the religious, the cultural implications of those measures. In addition to that, we know that the effectiveness of the measures really depends on their acceptability, the buy-in by the public, by the communities. Whenever the PTF puts out guidance, it's never done in isolation to the state governments. We always tell them in advance what our likely recommendations will be. If we get approval from Mr. President, we go back to them and tell them what part of the recommendations have been approved or not. We'll continue to work with the state governments to make sure that whatever is put in place is in the best interest of their citizens. We're in the business of saving lives. When it comes to restrictions, I'd like to first of all give you an example. Saudi Arabia, for instance, I'm sure some of you are aware, they've had about 240 deaths. They've had 40-something thousand infections. So their case fatality rate is much, much lower than that of Nigeria. But what have they done? They've actually, they're planning to completely lock down the country, 24-hour lockdown for the 5 days during the period of the Eid. Have we had any Umrah this year? No. Are we likely to have Hajj? We probably won't. So we are living in unusual situations. We are living in unusual times. And as far as we know, from the point of view of government, the role of government is to protect the life of their citizens and ensure their well-being. In this regard, we will continue to work with the state governments, but we are also pushing towards a different approach as we move on to the next phase of the pandemic. We're going to insist on state governments starting to take ownership of the response. We will support them in taking decisions. We'll provide them with the best guidance based on the data available, but we will not continue to drive this response centrally from the federal side. We expect state governments to have the capacity to be able to implement those measures required to safeguard the lives of their people. So in this regard, as far as we are concerned, state governors will continue to have that responsibility as we move forward, but we hope that we'll be able to work very closely with them and make the best use of science and also consider the different socio-cultural and religious aspects of those communities when we enforce guidelines. And again, I would like to make the public aware that as we go into Salah and period where people congregate, visit each other, in a pandemic situation where the epidemic is clearly going into the exponential phase, not only is it risky, but it is unwise for you to go into large groups of people without any protection, with no face mask, without respecting physical distancing. All the mask gatherings, and that trouble will not come immediately. It will come in the following weeks, 2, 3, 4 weeks, when that will end up being infected. And do you want to be alive for the next Salah? Or do you want to enjoy this Salah, especially if you are at risk? Be around for next year. Is it? Or do you want to delay things considering unusual circumstances where you continue to enjoy future Salahs with the loved ones? Issue of travel. For travel. Well, I'm not traveling as well, but there are restrictions for traveling, and we will only allow essential travel. I know there's a lot of pressure to allow Nigerians to travel for these holidays. We are possibly going into 4 or 5 day holiday period. But we will consider each case separately on an individual basis, and we'll take a decision on that. But certainly there won't be any massive approvals for travel. Timelines for planned resumption. So this doesn't just apply to the transport sector, it applies to businesses across the board. We are trying to open up the economy. I'm talking on the optimistic side when I say in the coming weeks, we are urging businesses to now start preparing for opening up, because we hope our economy and our country will start running again very soon. But now is the time over the next few weeks to start preparing. If you are an office setup, or you are a business, or you are a bank, you need to look at your sitting arrangements. You need to make sure that if you are receiving customers, that you respect those guidelines, because we will continue to enforce them even as we open up the economy. So please do start preparing, and hopefully in the coming weeks, we hope to move towards normality. Thank you.
The chair of the task force, members of the presidential task force, the honorable members from the House of Representatives, ladies and gentlemen. I had a question related to the Abuja declaration and how WHO is working with governments towards the achievement of that target. So as you'll all recall, in April of 2001, the heads of state of the African Union countries met and pledged to allocate 15% of their annual budgets to the health sector. And 19 years down the road, a few countries have met that target. Some are on track, and a number of countries have not made progress. And with the coming of the COVID pandemic, we're definitely seeing that our health systems are stretched. And there's never been a time like this that the investment in the health sector is more evident as a necessary investment. And it's not just in primary health care towards achieving universal health coverage, but also health security to ensure that we have systems that can rapidly detect diseases of epidemic potential and be placed to respond aggressively to mitigate the effects of these outbreaks. WHO is working at all levels, right from the global level to advocate for investments in health. We are a champion of universal health coverage, and we've worked through platforms like the G7, G20, the World Health Assembly platforms, and at the regional level through the African Union and regional committees on health, really just to push the message that we must invest more in health systems to be able to achieve universal health coverage and health security. We also are working with partners to continue to generate evidence on the impact or the effectiveness of investments in health towards reducing mortality. And all this is really to galvanize the support from governments as the drivers of health programs in countries to invest in health. A question was posed on the funding, the halt in funding from the United States to WHO and its impacts. I'd just like to mention, indeed, the United States has been a long-standing partner and friend of WHO, and we hope that it will continue to do so, or to be so. We regret the decision of the President of the United States to halt funding to WHO. WHO viewing the impact of the halt on our work and any withdrawal of US funding, and will be working hard with partners to fill the financial gaps we face and ensure that at this critical time that the work continues uninterrupted. I would also like to mention that at the just concluded 73rd World Health Assembly that held on 18th to 19th of May, that included ministers of health from around the world, the 194 member states, as well as heads of state from 14 countries. The consistent message throughout the meeting was that global unity is the most powerful tool to combat the COVID outbreak. A resolution was adopted at the Assembly for intensification of efforts to control the pandemic and for equitable access and fair distribution of all health technologies to combat the virus. The Assembly also called for an independent and comprehensive evaluation of the global response, and WHO will be initiating an independent evaluation at the earliest opportunity to review the experience gained and the lessons we have learned, and to make recommendations to improve national and global pandemic preparedness and response. Thank you.
Thank you very much. we shall take further responses from the Honorable Minister of State Education, followed by the Minister of Foreign Affairs and the Honorable Minister Information and Culture. Honorable Minister of State Education.
Well, good afternoon, everybody, or good evening, everybody. There are two quick questions. The first one has to do with our Braille students. I did explain a few days ago that for our impaired students, there are no online provisions for Braille that is available. But I will believe that all Braille students would have taken home what they call the Braille pack, and that's what we can work with at the moment. The online services that have been provided can't actually deliver Braille. So at the moment, we deeply apologize to students who are visually impaired that what they have are the packs that they took home at the limits of what we can do at the moment. We then will address the issue of when we can reopen. I'm sure when Uncle Lai comes on board, he will tell you that Suru Lere, Suru. We all are seriously interested in reopening, and we believe we will reopen soon, but I can't confirm that what your children said, that we can open in 2 weeks. The issue around reopening has nothing to do with the availability of the schools or not. It has a lot to do with national governance. The idea of shutting down the schools is not anything to do with the schools per se. The national body, and you hear the SGF, the chairman keeps saying, is a national response. There's a single national response. And everything we do flows from that. When they determine, I'm sure you've seen all the experts on this side, when they determine that there's a measure of safety to which we can expose our children, we will gladly do that. We are watching and we are working with all bodies within and outside the country. The 5 countries of WAEC are meeting. I've just come off a meeting with the AU Ministers of Education, where everybody is as concerned as you are. We hope to reopen very soon. This morning, I met with Ministry of Science and Technology. We're looking at putting measures in place that can disinfect every child as he goes into a school and disinfect him as he goes out. If we resource our schools properly, we can begin to reopen. But we must be able to ensure that the children go in safe and come out safe and not become conduits for further infection in the society. I think that's principally what we would like to do. But keep the dates open for now. Thank you.
Thank you. Yes, I had, I think, 4 questions, actually. And the first one was in respect of India and how soon we can start bringing our nationals in India back home, especially that some hotels have said that they want to see the money before they accept anybody. And now we're hopeful of getting the money. Yes, we're hoping very soon to start bringing the evacuees from India, as I said, and I understand from the I was informed that it might require advance notice of some days, I think 8 days, before they give the landing rights in India. So we're working on that, and we hope to have them with us soon. The second one was whether the Saudi evacuees who arrived, or the Nigerians from Saudi Arabia who arrived 2 days ago are under quarantine, and the answer to that is yes, that they are under quarantine. Then there was a question of air travel for the evacuees. Yes, I mean, we will bring them back by air, but there's a list of different countries that are waiting to be evacuated. So it's not, all the, we can't evacuate all the countries at the same time. Then there was a question regarding Cotonou, Benin. Some Nigerians who have arrived there, and what the situation is that they were asked to pay for tests, and they were taken to a hotel for quarantine where they're having to pay. I was in touch with our ambassador there, and he's informed me that there are 8 Nigerians who arrived on the flight. They actually originated from Berlin, Germany. And he has been in touch with the Beninois authorities and the evacuees, and is making arrangements to have them transported to Nigeria. He's not aware that they were made to pay an exorbitant amount for the test. But I have been in touch, so he got in touch with the immigration people at the border, and waiting to hear from them. I subsequently got in touch with our Consul General, Controller General of Immigration, and he's assured me that he's given directives for the border officials to allow them in, and they will also now make arrangements for quarantine for them when they are in. So the matter is being addressed very quickly. Thank you.
Honourable Minister, Information and Culture.
The Chairman and the Vice Chairman, House Ad hoc Committee on COVID-19, the Chairman, PTF COVID-19, Honourable Ministers, members of the Task Force, gentlemen of the press. You will recall that a few days ago I was here when I gave you the latest outcome of the annual polls, which actually confirmed that over 99% of Nigerians are aware of COVID-19, and that more than 95% have actually heard about the precautions that they need to take, such as physical hygiene, not congregating, social distancing, and the like. But yet, it's regrettable that some Nigerians, despite being aware of COVID-19, despite having heard about what they ought to do, have refused to accept, for whatever reasons, that COVID-19 is not only real, but it's taking away many lives. And that is the case of the issue of some road transport workers who have refused to heed to the advice and recommendations of the PTF, especially as regards how many passengers they should carry. We will continue to engage with them, and I'm glad that both the national coordinator and I think Minister of Health, said that we are constantly talking to the state governments and asking them to take ownership and possession of this fight. We've also encouraged them to engage with the National Union of Road Transport Workers and all other stakeholders. And I think that will be that's probably the most effective way of getting down this message to the grassroots. We need to carry along, we need to convince associations and unions on the need to convince their people that not only is COVID-19 real, it is very, very dangerous. Even today at the PTF meeting earlier today, we reinforced the need to continue to work with subnationals, local government chairmen, state governors. But like the national coordinator said, we cannot micromanage from the center here, what happens in the state. But we'll continue to encourage the governors to engage these various associations. And one positive thing is that when we get like the NRTW involved in this kind of campaign, they have a mechanism which is very efficient and very effective to compel their people to obey their own regulations. So we will not stop, we'll continue to engage them through the governors and through the local government chairman. On the issue of prices that have gone up, once again, I think it's the same approach. We need to talk to the National Union of Road Transport Workers and other similar associations that this is a time for compassion. Yes, COVID-19 has affected and impacted negatively on every sector of the economy, everybody's lives. But if you look at what is going on in other parts of the world, this is precisely the time that people are giving back to society. I listen to news from every part of the world, and I see how companies that normally, manufacture perfumes are today now manufacturing sanitizer and giving them away almost free of charge. So I think we want to call on our compatriots not to take the opportunity of COVID-19 to further oppress or further make life difficult for their compatriots, but look at it a time of sacrifice so that we can all come back together stronger from this COVID-19 pandemic. As to the issue of whether schools are going to reopen or not, I think the Honorable Minister of State Education has answered. No, it's not true that in 2 weeks' time, the schools will be opened. So you are going to be at home for more than 2 weeks with your sons. I think now I can explain in Yoruba. Ẹ ṣé púpọ̀ ní àkọ́kọ́ ẹ fi yé wa wípé àwọn oníṣẹ́ mọ́tò, àwọn tó ń wa mọ́tò àti àwọn tí wọ́n ní mọ́tò ó dàbẹ̀ ni pé etí ikún ni wọ́n kọ sí gbogbo nǹkan tí ìjọba gbà wọ́n ní àmọ̀ràn, pàtàkì jùlọ wípé wọn ò gbọ́dọ̀ gbé ju èèyàn mẹ́ta tó bá jẹ́ pé tasí ni ẹnìkan wájú èèyàn méjì lẹ́yìn, tó bá jẹ́ pé kẹ̀kẹ́ nàpẹ́ẹ̀pù ni wọn ò gbọ́dọ̀ gbé ju méjì lọ. Ṣùgbọ́n ó dàbẹ̀ ni pé bí ẹ ṣe sọ wọn ò tẹ̀lé ìlànà yìí. Wọ́n tó 4-5 nínú tásí wọ́n sì ń tóbi mẹ́rin márùn náà nínú kẹ̀kẹ́ napep tó àárọ̀ wọn náà ni nítorí ọ̀rọ̀ wọn dàbí wọn ni wọ́n ń torí àjàjà àjàyíta ló ń jà lẹ́kùnlé òun ni nítorí wọn tí nítorí aráàlú ni ìjọba fi ṣe ètò yìí nítorí pé COVID-19 yìí kò mọ̀ pé ẹnìkan ló kéré tàbí ẹnìkan ló tóbi o kò sí ẹni tí ò lè kó ojú ìjà kọ ìmọ̀ràn ìjọba wípé kí a má máa pọ̀ nínú mọ́tò nítorí nǹkan kan kọ́ nítorí ara wa ni pàtàkì jùlọ ẹni tó wa mọ́tò fún rẹ̀ gan òun gan lè kó àrùn yìí tí ò bá gbọ́n tí ìjọba ń sọ ṣùgbọ́n a mọ̀ wípé wọ́n ní atọ́kùn wọn sì ní àjọ tó ń ṣe gbogbo ètò àwọn onímọ́tò tá à ń pè ní National Union of Road Transport Workers àwọn gómìnà wa àtàwọn council chairman wa wọ́n ti ń bá wọn sọ̀rọ̀ pé kán jọ kán pe àwọn èèyàn wọn wọ́n sì sọ fún wọn wípé gbogbo ohun tí ìjọba gbogbo ìlànà ìjọba yìí ò nítorí tiwọn nítorí ti aráàlú ni kò sí ní tí ìjọba fẹ́ gbà nípa pé kó má gbé ju èrò méjì mẹ́ta lọ àti gbọ́ ẹ tún fi wá wípé ó dàbẹ̀ ni pé wọ́n ti fi lé owó mọ́tò wọ́n sọ pé torí kí tó pẹ́sẹ́ o COVID-19 ló jẹ́ kí gbogbo nǹkan wọn kò sí ẹni tí COVID-19 kò sí ẹni tí ó kàn ó kàn nílé ó kàn àlejò ni o ó kàn lówó ó kàn tálíkà ni o ṣùgbọ́n àsìkò yìí ló yẹ kí a fi ìfẹ́ hàn fún ara wa tẹ́ bá rí bọ́n ṣe ń ṣe lókè òkun àwọn tó ní wọ́n ń fi àsìkò yìí ran àwọn tí ò ní lọ́wọ́ ni kò kí ń ṣe pé àsìkò yìí láti máa wá ní ara wa ní ara láti máa bẹ àwọn èèyàn tó bí pé kánjọ kan bá àwọn èèyàn wa sọ̀rọ̀ nítorí tí wọ́n bá ti ń fi lé owó mọ́tò owó oúnjẹ náà tún máa wọ́n gbogbo nǹkan ní ó gbowó lórí kì í ṣe àsìkò yìí ló yẹ ká nira wa lára àsìkò yìí ó yẹ ká fi àánú hàn ká fi ìfẹ́ hàn fún ra wa ni láìpẹ́ láì jù lágbára Ọlọ́run ní pẹ́ tí a fi borí àìsàn yìí nípa ti pé àwọn ọmọ iléèwé wọ́n ó bẹ̀rẹ̀ iléèwé ní ọ̀sẹ̀ méjì irọ́ ńlá ni o mínísítà ètò ẹ̀kọ́ ti fi tó yín létí sì ti fẹ́ náà létí pé kì í ṣe àwọn skul ni wọ́n ti iléèwé wọn o n tó dé lónìí ká wá pé òun o tá a bá sì ní ìdánilójú wípé àrùn yìí ó ń lọ́lẹ̀ ká sì ṣe àwọn ètò tó yẹ pé tí àwọn bá padà lọ sí skul kò ní jẹ́ pé tí wọ́n gbé lọ nílé tí wọn ò gbé lọ nílé ni wọ́n gbé padà ó dìgbà náà ká tó sí àwọn iléèwé wa ṣùgbọ́n à ń bá gbogbo àwọn principal náà là ń bá sọ̀rọ̀ àti àwọn headmaster gbogbo wọn là ń bá wọn sọ̀rọ̀ yìí pé tó kí wọ́n ní sùúrù o tó bá ní sùúrù tá a bá lè yanjú ọ̀rọ̀ yìí nígbà yẹn ni àwọn ọmọ iléèwé ni wọ́n máa tó padà wá sí iléèwé ṣùgbọ́n ẹ jẹ́ ká tún rọra wa wípé ọ̀rọ̀ tó wà nílẹ̀ yìí o ọ̀rọ̀ ìjọba kọ́ o ọ̀rọ̀ Nàìjíríà nìkan sì kọ́ ọ̀rọ̀ gbogbo àgbáyé ni COVID tó wà Nàìjíríà náà ló wá lu òyìnbó kò yàtọ̀ o torí kò sí àwàdà tí àwọn aráàlú wa tí wọn ò máa fi COVID-19 ṣe. Ìkan ó ní òun ti fi sínú gàrí òun ti mú kò lè ṣe nǹkan kan irọ́ ni o wọ́n dá wọn lóhùn o Ọlọ́run ọba yóò jẹ́ kí àsìkò yìí kó kọjá kó jẹ́ pé àwa la máa kọ ìtàn COVID kí COVID kó má kọ ìtàn wa. Ẹ ṣé púpọ̀.
Thank you, Honorable Minister, Information and Culture. I now invite the Chairman, House Committee on COVID-19, Honorable Dr. Michelle.
Thank you very much. My colleague from the National Assembly, the Vice Chair of COVID-19, the Chairman of the Presidential Task Force, who doubles as the Secretary to the Federal Government, my friend and schoolmate, Barrister Boss Gida Mustafa, other members of the Presidential Task Force, the very important members of the fourth realm of the estate. May I begin by saying that we are here in observer status. And even if I have not been asked